Hi, I'm Dr. Jack Adrian of Chiro Center, and in just 5 or 6 minutes, I'm going to share with you a brand new drugless approach for the treatment of diabetic neuropathy that is bringing help, hope, and relief to literally thousands of people throughout the country. If you deal with diabetic neuropathy, this information may be some of the most important information that anyone has ever shared with you. So I'd like to ask you not to jump ahead on this video, because I would first like to share with you the reason why so many people with diabetes develop neuropathy to begin with. And then once you understand the cause of diabetic-induced neuropathy, you'll clearly see the scientific rationale of this new treatment approach, of which I'm sure you will agree all makes very good sense. The word neuropathy means nerves that are sick or distressed. And there are many individual causes and combinations of causes that lead to this disease. But this particular video is meant to help those individuals that suffer with diabetic neuropathy. And if you suffer with this disease, you don't need anyone to tell you just how agonizing and miserable it can be. Approximately 60% of all people with diabetes develop diabetic neuropathy, and the symptoms vary widely among individuals. Some people experience pain, burning, aching, stinging, and swelling. Others deal with electric shock-like sensations, hot or cold legs or feet, tight, vice-like gripping around the legs or ankles, pins and needle sensations, to the feeling of walking on ground glass or that of hundreds of little bugs crawling all over their feet or legs when none are really there. All of this often leading to restless legs, poor quality sleep, and chronic fatigue. Some people only have one or two of these symptoms, while those with more advanced cases can suffer all of them at the same time. Simply put, neuropathy just plain hurts. Compounding the problem with diabetic neuropathy, it almost always grows worse over time, often developing into numbness so severe that people can't feel where their feet are under them, therefore leading to balance issues, falls, and broken bones. At its worst come scratches, sores, and infections that won't heal properly, resulting in more than 86,000 people in the United States each year experiencing diabetic-related amputation because of uncontrolled neuropathy. When we combine all these things with all the other issues that frequently go with diabetes, it should go without saying that diabetic neuropathy is a very serious disease and should never be ignored or taken lightly. The primary cause of diabetic neuropathy is known as ischemia. Now, that's a confusing healthcare word, and at Chiro Center, we like to speak plain English. So, ischemia is a word that simply means tissue death due to starvation. You see, nerves are living tissues that need fed. But in diabetes, when too much sugar circulates through the bloodstream for too long, the small capillaries that carry blood to the nerves in your legs and feet, and later in your hands and fingers, become clogged with glucose. It's much the same thing that happens with a clogged pipe in your sink. The fluids can't get through. When the capillaries become clogged, this restricts nutrients and oxygen in your blood and starves the millions of microscopic nerves they are intended to support. As a result, the nerves begin short-circuiting, much like rubbing two live electrical wires together, which leads to a vast array of the symptoms found in diabetic neuropathy. Most individuals with neuropathy have done everything any doctor has ever asked of them. Many of you have had test after test after test. You've tried creams, ointments, and one drug right after another. It makes no difference which drug. And some of these treatments do work for some people for a while until they stop working. But most of these approaches just lead people down a road of repeated discouragement. For you may be surprised to learn that none of the drugs given for neuropathy were ever intended to treat neuropathy to begin with, because none of them address the underlying cause of nerve starvation, ischemia. But don't give up hope quite yet. In association with a leading clinical researcher in the field of neuropathy, Chiro Center is pleased to bring to the people of our community a brand new approach that is helping thousands of people throughout the country lessen, and in many cases even defeat, the misery of diabetic neuropathy. Internet time restraints don't permit us adequate opportunity to devote time to showing each of the many treatments. But I would like to share with you just a few of the treatment procedures we utilize in this new neuropathy treatment system. The mainstay of the peripheral neuropathy treatment program centers around a unit known as the sensory integrator, a painless, low-level form of soft laser, where the light from nearly 300 rapid-pulsed infrared and near-infrared light-emitting diodes penetrates the skin of the feet and legs to assist in new capillary formation and nerve growth. Introduced by NASA, it was originally developed as a way to speed up cell regeneration rates to provide faster plant growth and food production for long-term space missions. Once found to be effective with plants, inquisitive minds began researching it as a way to speed cell regeneration to reduce healing time and diseases of we human beings. They weren't disappointed when they began researching it to be used with neuropathy. This remarkable therapy nearly doubles the rate of human cell regeneration, exactly what is needed in neuropathy to assist in new peripheral nerve growth. Additionally, it serves to release a natural pain-relieving compound found in the soft tissue linings of your blood vessels known as nitric oxide, which also helps bring about relief. This alone is not all that's needed in our battle against neuropathy. Indeed, we're only getting started. It's been found that different types of nerve endings in the body require different vibratory frequencies in order to heal and respond most efficiently. This is the part that most of our patients enjoy the most. Our program utilizes up to 3 different frequencies of vibration on different areas of your lower extremities, which further stimulates nerve regeneration and aids in the reconnection of the peripheral nerves with the tissues they serve. Tissue vibration also serves to reintroduce proper sensation and balance, and in many cases further aids in pain reduction. Gentle rhythmic squeezing is often provided for the soft tissues of the feet and calves. This is necessary in order to promote increased circulation into the lower extremities, which helps support nerve rebirth and regeneration. However, we still don't stop here. We also utilize gentle and all-important joint mobilization to remove any restrictions preventing proper joint and gait motions of the lower extremities that many people develop as a result of neuropathy. Some patients with neuropathy also need nerve decompression therapy to remove the pressure off the spinal nerves. And we utilize this in those cases where it is needed, and when necessary, also employ reverse polarity therapy through mild electrical stimulation to aid in the reintegration and correct directional flow of your body's natural electrical nerve currents. From there, we look at any needed stretching or strengthening maneuvers, nutritional support, home procedures, and/or personal coaching to help you in your quest to achieve the most optimum results that your body is capable of providing you. All these procedures are completely safe and for almost all people totally painless. Again, most of our patients are very pleased and relieved to know that we utilize no drugs, injections, or surgeries in this new treatment approach. So let me ask you, how does this compare with everything else you may have already tried for neuropathy? As you've been able to see, this innovative program is thinking years ahead of the failed drug treatments out there today. A thorough examination will allow us to decide if you are someone who qualifies for this new neuropathy treatment system. And it's important to understand that each individual we're able to accept always begins at a different starting point. And while I wish I could be like that little witch on TV and wiggle my nose and make everything instantly better for you, you already know that your results are up to your body's ability to respond to the treatment. While it is true that no treatment in any branch of healthcare is 100% effective for everyone, thousands of people with diabetic neuropathy across the United States who've utilized this new treatment approach have experienced extremely favorable results. If you're an individual dealing with the challenges of diabetic neuropathy, don't give up. Give us a call at Chiro Center and let's sit down together and see if this new treatment approach may just be the answer you've been looking for. Once again, I'm Dr. Jack Adrian. Thank you for watching. And all of us here at Chiro Center certainly hope that you can be one of our next success stories.